Aloha.
Good morning. Thank you so much for that beautiful protocol, for that welcome. Thank you to everybody for being here. Thank you to my mother for being here. Thank you to the staff, on my personal office, the Senate Committee on Indian Affairs, for making a long journey to put this together. I want to thank the East-West Center for continuing to be the premier place for convening in the Asia Pacific region and giving us this beautiful venue to conduct this important hearing. It is great to be here at home among friends to talk about how we can work together to meet the needs of the Native Hawaiian community. Since I took over as chairman of the Senate Committee on Indian Affairs, we have worked to amplify Native Hawaiian voices and center Native Hawaiian needs on the committee, in the Senate, and beyond. And that's because too often Native Hawaiians are left out of the conversation about the federal trust responsibility because people don't understand the unique way that Hawaiians engage with the federal government through trusts and state agencies instead of a single centralized government like Indian tribes. But this is no excuse. The federal government has a trust responsibility to Native Hawaiians, just like it does with American Indians and Alaska Natives, and that trust responsibility must be met. And that's why we brought this conversation home for the first time in more than a decade to hear directly from you about how the committee can seek equity for Native Hawaiians, to hear about your successes and your challenges and your recommendations for supporting a thriving Native Hawaiian community. Over the past 2 years, we've made a lot of progress. We delivered the biggest federal investment in American history, more than $270 million in direct funding for Native Hawaiians. $270 million from the federal government in direct funding for Native Hawaiians. Now, there's two ways to look at that. One is that that's extraordinary, and that's great. The other is, as William Isla's an able deputy reminds me, it's also not enough. It is just the beginning of what we need to accomplish. But we did accomplish increases across the board for housing, education, healthcare, food and agriculture, high-speed internet connectivity, and culture and the arts. We also helped to secure important policy changes in the Violence Against Women Act to address domestic violence in the Native Hawaiian community, including setting up a review of federal crime prevention, victim service, and criminal justice programs serving Native Hawaiians, ordering a federal report on Native Hawaiians in the criminal justice system, and sending $1 million in new funding to Native Hawaiian Resource Center on domestic violence. This is just the start, because we know that we have so much more to do. So I look forward to your testimony and our discussion. I want to extend a warm welcome to all of you, and especially to say aloha to our witnesses. And I'll now introduce our first panel. First, we have the Honorable Carmen Hulu Lindsay, Chair of the Board of Trustees of the Office of Hawaiian Affairs. Then we have Mr. William Isla, Chairman of the Hawaiian Homes Commission, and Mr. Kuhio Lewis, the President and Chief Executive Officer of the Council for Native Hawaiian Advancement. I'll remind our witnesses that we have your full testimony as part of the official hearing record, and we'd like you to try to target something less than 10 minutes for your initial testimony, although it's just us, so if you feel like going 12, nobody's feelings will be hurt. Chair Lindsay, please proceed with your testimony.
Thank you. Aloha to the Chairman Schatz and Vice Chair Murkowski, if she's watching today, and members of the U.S. Senate Committee on Indian Affairs. Mahalo nui loa for inviting me to testify on behalf of the Office of Hawaiian Affairs and our beneficiaries, the Native Hawaiian community. We are pleased to welcome you to our island home, to engage face-to-face with our Native Hawaiian community. And while many of you may be joining us by video conference, we hope that you will feel the aloha spirit we bring and offer to you. This field hearing allows us to convey and illustrate to you what it means to uphold the federal trust responsibility through the exercise of self-determination our rights to chart our own course and maintain our distinct traditions, cultures, language, and native ways, and our rights to economic equity and prosperity, and the necessary support to raise the standard of living, health, and social well-being of our people in our homeland. Chairman Schultz, OHA continues to recognize your work on behalf of our families in Hawaii. You have been a champion on stopping the trafficking of Hawaiian women and children, including Native perspectives in federal climate action and addressing disparities for Native Hawaiians in health, education, broadband access, and food security. We are particularly grateful for your continuing efforts to ensure that Native Hawaiians are eligible for and gain access to federal policy and funding, healthcare, housing, education, food, and social services, and supporting research, resource, and innovation and equity centers. We request the committees and Congress's support in honoring the federal trust responsibility via policy, funding, and programming implementation in the following ways. 1, funding for a commissioned report of land succeeded to the stewardship of and management by the state government via the 1959 Admissions Act, including the Hawaiian homelands for the benefit of Native Hawaiians pursuant to the Hawaiian Homes Commission Act 1920. 2, ensuring that Native Hawaiians are included in all federal conference, coordination, engagement, and consultation policies and practices. 3, persisting in the accelerated defueling and closure of the Red Hill fuel storage tanks. 4, funding environmental assessment and cleanup of sacred lands polluted and contaminated by the United States military. And 5, ensuring funding and programming equity for all Native Americans, including American Indians, Alaska Natives, and Native Hawaiians. Established by our state's constitution, OHA is a semi-autonomous agency of the state of Hawaii, mandated to better the conditions of Native Hawaiians. Guided by a board of 9 publicly elected trustees, all of whom are Native Hawaiian, OHA fulfills its mandate through advocacy, research, community engagement, land management, and the funding of community programs. Hawaii state law recognizes OHA as the principal public agency in the state responsible for the performance, development, and coordination of programs and activities relating to Native Hawaiians. Furthermore, state law directs OHA to advocate on behalf of Native Hawaiians, to advise and inform federal officials about Native Hawaiian programs, and to coordinate federal activities relating to Native Hawaiians. In 2020, OHA enacted a new 15-year strategic plan for 2020 through 2035 entitled Mana I Mauli Ola, Strength to Well-Being, and builds upon 3 foundations that have the power to affect the well-being of Native Hawaiians. 1, Ohana, which is family. 2, Mo'omeheo, culture. And 3, Aina, land and water. OHA is building off these foundations to bring OHA's vision statement to life. Ho'oulu lahui aloha, to raise a beloved lahui. OHA believes that what is good for the conditions of Native Hawaiians is good for Hawaii as a whole. As a state agency, OHA is able to be a conduit for effective programming and funding for the committee and Congress. Over the past 40 years of existence, OHA employed multiple mechanisms, such as direct service staffing via payroll, contracts, memorandums of understanding and agreements, direct appropriations, loans, and grants to and with NHOs and communities to effect its work on behalf of our Native Hawaiian beneficiary community. OHA stands ready to assist the committee and Congress in accomplishing this important work, both now and in the future. I have OHA's Chief Executive Officer, Dr. Sylvia Hussey, and our legal counsel, Sherry Broder, here to respond to any committee questions and or provide follow-up information. Thank you for this opportunity to testify.
Thank you. Thank you very much, Chair Lindsay. Chair Isla, please proceed with your testimony.
Thank you, Chair Schatz. Hello, Chair Schatz. Vice Chair Murkowski is not here, I understand, but I understand her staff is here, so please send our love to her. Members of the U.S. Senate Committee on Indian Affairs, thank you for inviting me to testify on behalf of Hawaiian Homelands, which is governed by the Hawaiian Homes Commission Act of 1920, which was enacted by Congress to protect and improve the lives of Native Americans. Spearheaded by Prince Jonah Kuhila, not only the Hawaiian Homes Commission Act sets aside its public lands called Hawaiian Homelands to establish a rehabilitative program for Native Hawaiians. As required by the Admission Act of 1959, and as a compact with the United States, the state and the people of Hawaii adopted the Hawaiian Homes Commission Act as a provision of the state constitution and agreed to faithfully carry out the spirit of the Hawaiian Homes Commission Act. It's unfortunate that we are far away from statehood, that we have to remind other state agencies and county agencies of that pact. It's very important in terms of the future development for housing. The HHL conducted a study amongst all of its beneficiaries, current lessees, and waitlist applicants for homestead awards in 2020. The purpose of this study was to assess the current condition and needs of the HHL beneficiaries as was designed to be consistent and similar to previous studies conducted in 1995, 2003, 2008, 2014. These studies provide the most recent beneficiary data. In addition, the U.S. Housing and Urban Development Commission assessment of Native Hawaiian housing needs. Some of the key findings of this study include Native Hawaiians tend to be larger. In 2010, the average size of Native Hawaiian households were 4.1 people compared to 2.7 for residents of other Hawaiian households. Although improvements were made in the 2010 decade, Native Hawaiians living in Hawaii continue to be more economically disadvantaged, and they have lower incomes, higher rates of assistance received, higher poverty rates. Native Hawaiian households also experience higher rates of overcrowding, 15%, compared with residents of Hawaii. I have 3 generations living in my household on homestead lands. There are numerous other findings that I think you'll find helpful. In addition, the Hawaiian Homes Commission beneficiary household on the wait list face more significant housing challenges across all dimensions than all other groups. Nearly 40% of beneficiary households on the wait list were overcrowded, compared to only 19% of those sampled on Hawaiian homes. While 10% of the beneficiary households on the wait list lack complete plumbing, compared with 1% of all the other groups. The conclusions of this study guide DHHL's program that are ultimately aimed at upholding the federal trust responsibility to beneficiaries, and the continued support of this committee will help us address those needs. The first conclusion in the HUD study identifies the importance of Title 8 of the Native American Housing Assistance and Self-Determination Act to support the critical housing needs of Native Hawaiian families who are eligible to reside in the homelands. DHHL is grateful to Chairman Schatz for securing $22.3 million of the current fiscal year for Native Hawaiian housing, the highest level of funding ever appropriated by Congress, and requests continued funding at this level. No pressure. In addition, DHHL applauds the leadership of this committee by both Senator Schatz and Senator Murkowski in passing the housing reauthorization. The 2020 beneficiary study report identified 887 leases that earned 80% or less of the HUD with a house needing major repairs. Home assistance program is already assisted over 100 income eligible. The final area that I would like to highlight, and there are many others in the written testimony, is the plan to utilize the HASA funds to acquire land. DHHL's Oahu Island plan building approximately 1,300 acres of land suitable for residential leases is necessary to meet the homestead needs of the beneficiary households on the residential wait list that are not otherwise accommodated, assuming full implementation of our plan. Because of high demand and limited availability on one of the program areas exceed what's available currently in our community. Now I'll turn to the HHLRA. So the Department of Homeland supports, maybe back up a second, sorry. The 184 program, the Native Hawaiian Housing Loan Guarantee Program, notice section 184A provides access to mortgage financing to Native Hawaiian families who are eligible to reside on homesteads and would otherwise face barriers to acquiring such financing. As of June 30th, 2021, the HUD 184A loan program had 507 loans with a total outstanding balance of over $112 million. In FY21, from July 2020 to June 2021, DHHL processed over 77 HUD 184A loan guarantees, 535 federal housing FHA insured loans, and I guess that is.
No, I think that's just a microphone. Keep
That's
it.
microphone. Okay. Somebody's coming with the table. Turning to the HHRA. So the Hawaii Homelands Recovery Act acknowledges that the total of 1,400 acres of homelands with a total value in 1998 of 75 to 80 million continue to be used by federal agencies. There are subsequent credits for transfers that have occurred. However, and we're finalizing the amounts. The ask is that the Senate Committee on Indian Affairs consider, rather than waiting for federal lands to be accessed, that we come up with a monetary calculation and that funding be appropriated to DHHL in order to acquire lands, which will occur much quicker and give us the flexibility to find lands that are close to existing infrastructure, lands that are not greater than 20% in elevation, and lands that we don't have to do off-site construction. So the ask is that we consider the ability to have a financial closure of the Homelands Recovery Act. And I would just ask you to just one second. This is off script for me, but sometimes I do that. So where I come from, you know where I come from. I come from this place on the west side of Oahu, and it is a magnificent place. Please don't tell Dr. Mitchell because we don't want him to come to Hawaii. But I will just do a quick, only that is important to me about where I come from. And we have a lot of homesteads. We have actually I believe, still the greatest number of homesteads per capita on the Leader Coast in Japan. Couple is catching up, but they're not there yet. Oh, excuse me. Ala wai anai mo lali itala ayapono ake kula o kumano mano. Kuni kaloho a mauna lahi lahi o maha kui kawai lua lua lei. Le ana nuku anu ike ka makahala I pau ku ia me ka ahi. I o hi no au na uno o I ko ka ko kulia na paano ia. He lulima kia aloha e. It's a chant that as chair of the Department of Land and Natural Resources, I used to remind. It talked about the kumano grass that used to grow on the plains of Makaha and Kamai. It talks about the nukuanu blossoms that used to grow in the uplands of Waianae. They no longer exist. So that was my motivation for not allowing any more extinctions while I was a chair of the DNR. As a chair of the HHL, it reminds me that we have to do everything that we can to ensure support for Native Hawaiian households on DHHL lands and off DHHL lands, which is what we partner with a lot. Because the worst possible thing to happen, Senator, is 20 years from now, somebody has to write another movie, and the metaphor is beneficiaries leaving for someplace else because we weren't able to meet the housing needs. And that is what I leave you with. Juliana is a big part of that work, and it motivates me to do things better. We just would add that. Although we sit here at the table representing different organizations, we talk to each other often, and we bounce ideas, crazy ideas off of each other often in order to meet the challenges that face all of us. And I do want to thank Chair, and I want to thank Kuhio for being creative, being willing to sit down and just brainstorm about anything that could prevent somebody writing a chair. So with that, I'll say we're holding the Thank you.
Thank you, Mr. Isla. Mr. Lewis, please proceed with your testimony.
Aloha Chair Schatz, and your amazing committee. Mahalo nui for the opportunity to be here to share. I'm Leo Lewis. I'm with the Council for Native Hawaiian Advancement. We're a 501c3. We're a nonprofit organization. We represent and we support over 400 members who make up CNHA's infrastructure and our backbone. They're the backbone of the work CNHA does. I wanted to start off, Senator, by highlighting some of the things we've been able to accomplish over the last 2 years, which can be directly attributed to support from the federal government and by way of that, senators, the Congress. So first of all, I wanted to highlight the emergency relief program that CNHA has administered. We have partnered with the Department of Hawaiian Homelands, the state of Hawaii, and with the city and county of Honolulu, and we have been successful at distributing over $105 million to residents of our state. That's 80,000 checks, supporting over 14,000 households. This is not, there was no organization that had the capacity to lift up a program of this magnitude. So when the billions of dollars are coming down from Congress, we had to move quickly. And I position the organization to be solution-oriented to help uplift Hawaii, not just Native Hawaiians, but all of Hawaii, because I believe there is a sense of kuleana to this place in everyone that lives here. We were recently recognized by the United States Treasury as being top performing in the nation, amongst 5 others. And the program has had tremendous success in providing immediate stability to our families. However, we continue to look at ways in which we can continue that support so long-term they can find stability. Many of them have become overly dependent on the program, and so now we need to figure out how to transition them off. So these are some of the active discussions that are going on within CNHA as well as our partners. I want to also thank the federal government for the Papa Makeke, which really was born also during the pandemic. This is an online marketplace that has supported over 300 small businesses. It's provided means for them to survive. When the state of Hawaii shut down, hundreds of our small businesses shut down with the state. They didn't have a place to sell their products. These are Hawaii-based products. To date, the Papa Makeke has sold over 230 Hawaii-based products and shipped them around the world. We have put millions of dollars into the pockets of these small businesses. And again, I want to recognize that money that to get it started came from CARES Act funds, money from Congress. I also want to thank Congress for the SBA program. We've received millions of dollars from SBA to support our small businesses. We've supported hundreds of Hawaii small businesses find the right pivot so they can survive post-pandemic. Our Hawaiian Trades Academy, we've graduated hundreds of tradesmen so that they can find some degree of self-sufficiency in this rapidly moving economy. And our CFI has provided loans to dozens of our businesses and individuals who don't have access to capital. All of these tools and resources have provided many of our families stability. And so thank you for that. I wanted to highlight some of the initiatives that I believe are critical for CNHA as we move forward. And when I say CNHA, I'm speaking on behalf of those that we support and uplift. Number one, we will be focused on housing. As we know, too many of our families are moving away from our islands. Over half of our population now home outside of Hawaii. And with them goes our culture and the very thing that keeps Hawaii being Hawaii. So ensuring that they have means to live so that they can find some degree of prosperity, because it's just out of reach at this point. Economic development is huge. This is why we are focusing on building businesses up, investing in capacity building for our small businesses, access to capital to ensure that they have available resources to support their growth. And also grooming a generation of leaders, helping the next generation find their place in Hawaii so that they can help be a part of the solution long term. And most importantly, it's time that we start re-engaging in the discussion about a government-to-government relationship with the United States. The last couple of years, we've been focused on survival and how we survive as a people through the pandemic. But as we turn the page, I think it's a critical conversation. Our people are passing away, and with them, the intellectual understanding of what that means for our people and our survival in our homeland. So with that, Senator, those are the initiatives of our organization. Again, I just want to extend a big mahalo, because without support from Congress, many of our families wouldn't be housed today, they wouldn't have businesses, they wouldn't be where they are. So
Thank you to all of our testifiers. I want to start with Chair Lindsay. OHA had to expand emergency financial assistance this year to respond to growing needs. And I'm wondering if you can give us some, either color or data on what the level of financial is now versus pre-COVID time. Do you see a trajectory that's either encouraging or alarming? Where are we now?
I think that during the pandemic times, we had monies coming from all over the place, and we expended our own finances from OHA to help our people, but that's dried up. And I think there is a definite need. There are people that are not being able to pay their mortgage and pay their rent, and they are going homeless. So I think there is a real need right now to continue some kind of continuity to help these people. And the mechanism that we use, and I think most of the emergency funds used, was paying directly to the mortgage companies and the landlords and electrical companies and water company. So it's not as if the money is being wasted, it's true need. So if there is a possibility of continuity of this kind of funds, we need it here in Hawaii.
Thank you. New topic. We had a hearing, I guess it was now a couple of weeks ago, where we had Mark Patterson from the Hawaii Correctional System Oversight Commission. And he's had a fair amount of success with culturally based trauma-informed interventions for women and children. My understanding is that OHA is sort of stepping into this space, and I'm wondering if you can elaborate on what you're doing and how you think maybe the committee or the federal government might give assistance.
Thank you for that question. Just coincidentally, in the last legislative session, I was invited to a special group called the Women's Project, led by Governor Linda Lingo. And she assembled a very affluent group of women that wanted to help this problem. I met with him, and he described in detail what was some of the problems in our women's prisons. And I think that there were 10 bills introduced in the legislature, not all passed, but we are going to have a commission for the women's prison to help guide the department to improve the conditions of the women in the prison, in that they're able to see their children. You know, the women are the domestic part of a family, and the children is an important part of how they live their lives. So being able to be exposed to their children is a big thing in their recovery as well. So we would like to see that happens. And our prison is so dilapidated. And if there's funds that can help improve that condition, that would be very helpful, Senator. I believe Mr. Patterson has a good hold on it, and I have the highest respect for his leadership in that direction. I believe he spoke with you a couple of weeks ago, yeah.
Yes, and the one thing I'd note, and we have a couple of in the next panel, is that sometimes it's not a lack of programs, it's a lack of connectivity,
Yes.
you know, among these programs. So I always think back to my nonprofit times, and folks would get out of prison where they were receiving mental health services. And there'd be a break in case management, even medication. And the only way they could get care again is to re-hospitalize or re-incarcerate.
Right.
And so part of what we all have to do is to develop a series of recommendations, in my view, for the next governor. Because this has to be overseen at the sort of cabinet meeting level, so that the public safety department is talking to the Department of Health, is talking to the Office of Hawaiian Affairs, and we're thinking about the person who is coming out of incarceration and how she or he may transition back into being a productive community member. It's not enough to provide services once someone finds themselves in great difficulty. It's already too late by then. I'm struck by the fact that there is always a need for new resources, but sometimes we need to just coordinate the resources that exist a little bit better. And I'm hoping that maybe all of the people in this room can develop a series of recommendations for whomever ends up being our next governor to kind of oversee this. This is non-ideological, this is non-partisan. This is just about making things work. Let me move to Chairman Ayala. I have a bunch of questions for you. A couple of them are rather technical. Should the 184A loan program be available to eligible Native Hawaiians living throughout the state? So just for the records.
Remember to turn the buttons then. I think that would be a great thing, because the department, given its resources that it has and the land base that we have, will not be able to address all of the concerns. 184A is a great program. It's easily understandable. It's easily complied with. The only ask that I would have, Senator, is that it be made very, very clear that any changes to 184 being used off the homeland comes with a clear congressional intent.
That's my part of this job. Got it. Okay. You're increasingly using your subcontracting authority. Just talk to me about how that works and I think how successful it's been.
Prime example is the gentleman sitting to the left of me in the partnership with the CFJ. We hope that there will be more organizations, Hawaiian led, that will develop capacity to work with. However, we're still a state agency. People oftentimes forget that, and we still have to go through procurement. And so as other groups step up and can meet the qualifications of the procurement, we would be more than happy to partner with other groups to implement the programs that the department so desperately needs. It's a great partnership, and of course, staff at the state level is something that is fixed, and so it's the only way to go forward.
So that brings me to the capacity question. The legislature did something historic this year, hundreds of millions of dollars for Native Hawaiian housing in particular. And I guess my question is about is sort of two parts. One is, do we need to think about capacity building, not just the ability to kind of subcontract for management? But boy, this is a lot of money to expend and to try to do so responsibly. And given that the real estate market is really hot, to get excellent construction management people and real estate experts, at a civil service salary is an extraordinary challenge. So I'm just wondering if you can talk about how you see execution, and I don't want you to give me a pat answer. If you're not there yet, I'd rather you say, let me get back to you in 6 weeks rather than just give me a glib answer. So that's one question. The other is, how do the big infusion of federal funds, big infusion of state funds, how do these funds interact? How do you see them? Do they end up in a pile and going to the same purpose, or are they separate lines of effort?
So the personal question first. We have a plan. The plan is to utilize the positions that the legislature appropriated. Starting July 1st, we actually get to go out hybrid. We also have taken steps to utilize federal funds through the HASA to create exempt positions to do exactly that. Folks at the project management level to assist us with the construction side, with the procurement that's going to be necessary to deal with the down payment assistance, the mortgage assistance, because we don't have staff to do that. We don't have the expertise to do that. So that is something that's in progress. We've spoken with the governor, we've spoken with budget and finance. They have given us the green light to come forward with positions that we want to create that on July 1st get funded. That speaking with HUD, we feel comfortable through the House creating anywhere from 6 to 8 more positions to deal with the funds that are coming through the federal side. And also the ability to utilize those federal funded employees on some stuff, some of the state work. So it's the best plan that we can have for now. We do appreciate others joining in with us in creating capacity. And 2 years, 3 years is a very short time. So we need the governor to kick the budget and finance guys a little bit, give us that.
Well, let me know what you need, and then also I would just add that, one of my continuing frustrations, I have not always been totally kind to the department in all instances, but it's because of my passion for these issues. But I do think you're on the right track, and my new frustration, not to say you're where you need to be, but you're at least on track. But my new frustration is that there are people in HUD in particular who have not updated their view of the department and its ability to execute. And so we need to think together about how to make sure that the White House, that the Office of Management and Budget, that the Secretary's Office at HUD understands that this is a new DHHL. And whomever is running it, in 2023, regardless, you're going to be on a track that puts you in a position for success. My final question for now is just about density. I have communicated directly to the department about my desire to kind of open up the aperture. Certainly in the kind of Indian housing space, there's lots of very exciting things happening around density. And you've got a lot of people on that waiting list who would be perfectly pleased with a rental subsidy or a rental apartment or to purchase an apartment. And so I'm wondering how you're thinking about the kind of balance between the people who are still on that list, who still want that homestead, in Kula or on Moakaki, versus a lot of, urban Native Hawaiians who just want some help and are not so particular about the kind of real estate model or even the home type. And so I'm wondering if you can speak to the new flexibilities and whether I think it's not just the chairman of the commission, it's the commissioners, right, who may have a view. And so I'm wondering how that's all evolving.
Sure. Thank you for that question, Senator. Thank you for that question. So in the past 6 or 7 years, we have retooled the toolkit, if you will, of offer. So we have Kuleana Awards, which is basically, think of homesteading in the 1920s. Government gives you a map, here's your 4 pins, go get them, good luck. We have homesteaders that want that, believe it or not. We have homesteaders who have risen to the occasion in Inui and actually built homes and have actually thrived under those conditions. Then we have subsistence agricultural lots, which we have to do rulemaking in order to do so. It removes the requirement for this commercial 2/3 cultivation. So the idea being making lands available with minimal infrastructure costs and allowing people to do what they say they can do. Then we have turned from primarily a turnkey operation to one where turnkey is still available because some of the folks on the wait list desire that, but we also offer vacant lots. So vacant lot is something that I did 30 years ago with my wife. We hired a contractor. I did part of the work, he did part of the work. We put up a 3-bedroom, 2-bath house for something that I could afford on my salary as a harbor master at that time. That's what we need to do more of. We recognize that there are beneficiaries who are not in a financial position and will never be in a financial position to own a house. And that's where we're building rental opportunities. So in Waileili, we acquired a parcel right across the street from that. There's a tiny little house that's attached to that property. We hope to acquire it and then be able to put that out for an RFP and have in the range of 200 plus more rental units, as well as rental units throughout the state. The $600 million has guideposts for us. It says we would like you to take a look at housing products that remove people from the wait list, but also provide rental assistance and rentals to each county. So part of the process that we're going through right now is to conduct an analysis and then try to figure out where we take the $600 million to do that, where we take the money that you provided to us to do that, and if and when we have excess dollars from our lands that are in revenue generating, then we can fill those niches. So that's where we are. I think whoever replaces me has a wonderful roadmap, has momentum, and understand that you're going to hold us accountable.
Dear Paul, you're not going to re-up, sir. There are many other departments you can run, so you've only run 2. There's plenty more. Thank you, Will. I'm sorry. I'm very familiar with William. The first time we met was when he was the harbor master, and I was a 26-year-old legislator, and he brought me a picture of a pile of severed shark fins at Honolulu Harbor, and that was the first bill that I ever failed to pass, and then the first bill that I ever did pass. I'm working together with Mr. Ila, so thank you for that. Mr. Lewis, I'm really interested in Papua New Guinea. I'd like you to talk a little bit more about it, and I'm also, just a very basic question. What can the federal government do to help you scale? That's number one. And sorry for the compound question. The second question is it transitioning into a post-COVID model? And does that mean as people move to brick and mortar, does that mean the numbers are flattening or lowering, or is it just a booming economy and therefore it's going well? But I'm interested in mostly scale, but also how you're doing.
Sure. Say, Senator, the Papa Makeke was envisioned as just a relief tool initially to help provide immediate stability to these struggling businesses. But after fast forward a year and a half, we have over 40,000 customers now shop on Papa Makeke. We have data analytics that tell us what people want, where they buy it from, what their interests are. And so we have the tools that actually is what is very valuable to make a business. And so we have changed the model of Papa Makeke, whereas at one time it was basically we're doing it for free using federal funds to market their products. We are now using our CDFI to help incubate some of these businesses so they can get to a wholesale model, and we buy their products wholesale and then we sell it on the Makeke retail. So my goal is to make the Makeke self-sufficient so they can live on.
That's great. How's Treasury treating you?
On which program? They've been good. I mean, the challenge with some of these programs is that it goes through 3 layers of bureaucracy, if I'm being honest. It goes from the Fed to the state to the county sometimes, and we got to deal with all 3 of their interpretations of guidance, which is not always easy. But they have been great. I sit on one of their advisory boards now to help advise. There is a cultural gap in terms of their understanding of what Ho'oponopono is, for example. And so when we try to apply these things using housing stability funds, they're kind of reserved to it, they don't understand it, and so therefore the answer is no. So it's an educational process. But Treasury they've been receptive, but I think there's a lot of areas in which we can improve their understanding of the way.
I'm reminded of something somebody told me a long time ago, which is that the best social program is a good job. Thank you for what you're doing in this space. Are there federal programs that are not currently open to Native Hawaiians? You know what, I'm going to do this for all 3 panelists. I'll start with Mr. Lewis and do it this way. Are there federal programs that are not currently open to Native Hawaiians that could help? Is there a statute? And statutes are harder, right? Because then I need 10 Republicans. Not impossible, but more challenging. But sometimes, as I have sort of dug into the administration of the law, a lot of the difficulty is not that the law prohibits the participation of Native Hawaiian agencies and individuals and organizations, but rather that there are habits ingrained in the Department of Interior and the Department of Treasury and elsewhere. So I'm wondering I'm starting with Mr. Lewis, are there any programs that you think Native Hawaiians should be eligible for that they're currently not eligible for?
Thanks, Senator. I think I'll take the opportunity to highlight a program that I think would be very beneficial to Native Hawaiians. We're included, it's actually your bill, it's the Native Act, but I think there's an amazing opportunity within that for Hawaiians to take advantage of that because tourism is the backbone of Hawaii. It's the economy of Hawaii. And we have to be able to get into the economy in a meaningful way. We have to tell our own stories. I had lunch the other day or a month ago with the head of the Hawaii Visitors Bureau, probably know him, John Monahan. And we stand at the Pacific Club. They just gave me membership at the Pacific Club. At one time, we didn't allow Hawaiians to have membership there. But we had lunch there. I told him, yeah, let's get lunch. He wanted lunch. And so I told him, John, take a look around this restaurant, the dining room. So he looked around and he looked back at me. I told him, I don't want any Hawaiian in here. Well, Hawaiians don't get that eating here too. And I said, but John, if we go in the back in the kitchen or in the cleaners area, we'll find Hawaiians. So I told him, when do we get to this dining room too? When do Hawaiians get a chance to be in this economy alongside all of you? So I think there's real opportunity with this Native Act for Hawaiians to force themselves into this industry in which we can see economic development, business development, where we can train our people into these key positions that help drive the economy. So more resources in that arena would be amazing so that we can compete against these stakeholders in tourism. Because right now, the resources that are available are finite, and we're competing with people that have deep roots in the industry. So I love that act. I think there's amazing opportunity there, and we'd love to work with the office yourself on how we can be more deliberate in getting there. As far as other programs that Native Hawaiians are not included, the reality right now, Senator, is that there is a lot of resources that we can pursue that I don't think we're fully taking advantage of. We need to build up the capacity of grant writers or nonprofits so that they can seek out the current funding that you've already made available. Because that's the challenge. They all come to us to help write grants. We need to train more people to help them build up their capacity. But I don't know of any specific program that at this time because there's so much resource.
Mr. Ala?
One that immediately comes to mind, of course, is the USDA water, potable water program. And if we could wave a magic wand, we've developed a much better relationship with the county water supply boards. And so being able to partner with the counties, because they will provide revenue in which to pay back the loan, which is basically a loan grant from USDA. we can't do that because we don't want to run any more water programs that we already do. So that would be first come to mind, because one of the limiting factors for the department to develop is often being able to get water credits from the company. So that comes immediately to mind. Perhaps being eligible for some of the fish and wildlife grants, especially when it comes to wildfire protection, wildfire prevention. You know, we have lots of lands on the leeward side of the islands, climate change. Even in Waimea is undergoing the drought. That's unheard of in not only our lifetimes, but our grandparents' lifetimes. So we need to be able to manage our lands in a much more safe, but also having access to those programs that they do. Before I forget, because we may be wrapping up shortly, I just want to make sure, as I was walking out the room, I said to tell you, make sure you go swimming.
I'm waiting until it gets a little smaller first. Chair Lindsay.
It's gonna be everything then. Being in policy making, I depend more on operation. Sorry. Being in a policy making position, I depend more on operations to share with me where we can get some help from the federal government. But thanks to you, since you've been chair, we've gotten really more than we've ever had before. And I would like for my staff to get back to you with recommendations on what you can be more, how you could be more helpful to us. I definitely spoke with your staff the other day and asked if we could be, we're open to grants, applying for grants for OHA to distribute, so.
Thank you. And I'm going to submit a couple of questions to you, Chair, for the record. The first is the request that the funding for a commission report of land ceded to the stewardship and management by the state government via the 1959 Admissions Act. I was just talking briefly with my staff director about that. Under promise, over deliver. I want to make sure we can do this, but this may be something that we can work on. I'd also want to pay particular attention to how to do this in a way that is perceived as objective and is objective. Those are two different things, but they're both equally important, because if an analysis comes out and say state government disagrees with some of the findings, then we're going to be back where we started. So I think the how very much matters if we're able to pursue the resources. And then the other thing I'd like to ask all of you for the record is just about the capacity, because we're in an age, and I don't know how long it'll last, but we're certainly in a period where you're receiving more federal funds than usual. And I think planning for how to execute on that, and how to keep the money flowing, and how to understand where in each agency there are notice of funding opportunities. And then I know how it was when I was running a nonprofit. It's one thing to see a grant possibility on a piece of paper or on a something.gov website, but then you got to figure out who's going to write the thing. And so organizational capacity building on pursuing and then executing on federal funds is something I'd like to submit to you as to all of you as questions for the record. I really want to thank you for everything that you've done, first of all, but I also want to thank you for a really constructive panel. And I was hoping it would go this way, which is to say that we have a lot of follow-up homework. Let this be a continuation of our conversation and not a culmination of our work, but just an agreement that, okay, now we've got probably 5 or 10 lines of effort with each of your organizations to work on with staff. So there's a lot more to do together, but I am as hopeful as I've ever been about the possibilities. I want to extend a warm welcome and aloha to our witnesses. The hearing record will remain open, and I may submit some additional questions for the record. We'll now excuse our first panelists, thank them, and give them a hand. We'll take a 5-minute break as our next panelists get situated on the panel. Brief recess. We'll reconvene the Senate Committee on Indian Affairs for our second panel, and we are really pleased to have some extraordinary leaders talking with the committee and staff about the work that's being done primarily in Native Hawaiian education and health. First, we have Dr. Sherry Daniels, the Executive Director of Papa'olo Okahi. We also are pleased to have Dr. Winona Lee, MD, Associate Chair of Medical Education at the Department of Native Hawaiian Health at the John A. Burns School of Medicine at the University of Hawaii at Manoa, and Dr. Elena Farden, the Executive Director of the Native Hawaiian Education Council. I'll remind our witnesses that your full written testimony will be made part of the official hearing record, and we'd like you to target anywhere between 5 and 10 minutes for your testimony. Dr. Daniels, please proceed with your testimony.
Mahalo, and thank you again for inviting us to share on behalf of Papa'olo Okahi. So Chairman Schatz, mahalo, as well as Vice Chair Murkowski, who I understand is on video. And so your commitment to bringing us to the table is deeply appreciated. And I know the other earlier testifiers also shared that sentiment. In the spirit of the committee's legacy of strong bipartisanship in honoring the federal trust responsibility owed to American Indians, Alaska Natives, and Native Hawaiians, we want to thank you all who continue to contribute to today's field hearing. For those of you who don't know, Papa'olo Okahi was created in 1988 with the premise of improving the health status of Native Hawaiians through the passage of the Native Hawaiian Health Act, later reauthorized as the Native Hawaiian Healthcare Improvement Act. The language of the NHHCIA established a network of health resources, services, and infrastructure for Native Hawaiians through 5 Native Hawaiian health centers and systems, as well as our Native Hawaiian Health Scholarship Program under the coordination and oversight of QOL. Our mandates include support and coordination of related health services for Native Hawaiians, and we are grateful for the support of partners across the state, Native Hawaiian organizations, and communities who trust QOL with their work. Chairman Schatz, thank you again and your commitment for improving Native Hawaiian health and to honoring the federal trust responsibility owed to Native Hawaiians. Your efforts to secure pandemic relief and support for Native Hawaiian health in the America Rescue Plan Act of 2021, which we affectionately call ARPA, and other COVID-19 legislation have bolstered across to services for all Native Hawaiians across the state. And after our grant period ends in 2023, July, we look forward to sharing the stories and data that underscore the critical need for further robust investments in Native Hawaiian health. POL also acknowledges your work in other fields that affect health resource access, community safety, and overall well-being of Native Hawaiians and Hawaii residents alike. Your specific attention to the social determinants of health and the factors that facilitate healthcare delivery, accessibility, and utilization, such as increasing broadband coverage throughout the state, which ties to telehealth services, is needed to address the systemic issues in healthcare. Today, we share the successes made possible by not only your work, but those of your colleagues that fulfill the mandates of the Native Hawaiian Healthcare Improvement Act and address the needs exuberated or created during the pandemic. In addition, we identified barriers to fulfilling our mandate in ways that the federal legislation can continue to uplift Native Hawaiian health. The federal trust responsibility extends to all Native Hawaiians. An estimated population of over 300,000 Native Hawaiians reside in Hawaii alone. Native Hawaiian trust responsibility must be legislated with clarity so that it is understood and implemented in ways that ensure Native Hawaiians receive equitable opportunities as Indigenous people with a trust obligation. I'd like to share very briefly the work POL has been doing that would not have been possible without the work of Congress continuing to honor that trust responsibility. During the pandemic, our staff did everything from writing grants to showing up at vaccination and pop-up clinics to help talk to and engage with community organizations, and especially our Native Hawaiians, and asking them what they needed. Our pivot to digital work has produced dozens of online webinars to continue providing health resources and information. In 2022 so far, our social media has reached over 150,000 people, and this is on Facebook analytics alone, and that's huge that we're able to track that. We've also shifted health assessments and feedback mechanisms that used to be in person to help guide our decisions and what we see as benefits for Native Hawaiian health. This week alone, our staff are supporting virtual listening sessions for communities to discuss elder care needs around Alzheimer's and dementia. Generally speaking, the work POL does is in combination of our federal mandates as well as community feedback. While continuing to do the COVID-19 work, we have also not stopped doing the other functions of Papa'ololukahi in our pursuit of uplifting Native Hawaiian health. And that is seen in our growth. POL over the last 2 years has grown to over 30 staff into 6 different hales or departments. We processed and applied for over $2 million in federal, state, county, and private funding alone. And this is just in our wheelhouse. We also oversee the additional $20 million of ARPA, as well as our $20 million that comes into our act. Under these funds, we were able to uplift a health workforce, as well as partner with academic institutions around a health leadership certificate. I believe Mr. Lewis talked about workforce, and that was something we identified. The pandemic was in 2020 immediately concerning for Papa. Native Hawaiians are in this perfect storm of risk when it comes to COVID-19. There are disparities in chronic diseases such as diabetes, cancer, heart disease, and obesity. But we're also talking about social determinants risks, housing, economics. All of those things already impacted our Native Hawaiians, and we were overrepresented in even our unsheltered population, our prisons, our service industry, our employment. So their safety and well-being were also not just in the likelihood of contracting COVID-19 and their clinical needs, but also all the additional impacts around economic. Were they going to be employed? Were they able to provide a roof over their head? And as we know, because of this context in which we live and work in, we recently worked on a report about data justice in Hawaii. That Native Hawaiian data would be incredibly difficult to find and access. But fortunately, we weren't alone in thinking about this with our community needs. And by June 2020, we actually started supporting and providing all of the administration for the Native Hawaiian and Pacific Islander COVID-19 response, recovery, and resiliency team, affectionately known as NHPI-3R. And with over 60 partner organizations, both Native Hawaiians and Pacific Islanders, we've successfully supported dozens of testing and vaccination events, worked with our Department of Health to improve COVID-19 data for Native Hawaiians and Pacific Islanders. And we are the only state that actually disaggregates Native Hawaiian data from the overall data of COVID-19. While billions and then trillions of COVID-19 relief dollars was being passed through Congress, this coalition, our NHPI-3R team, received no funding. The power of partnership is real, and that's what had tangible results. So I want to make sure I give time for my other colleagues, but I think people want to know, where are the funds going? You got all this ARPA dollars. Where does it go? And we are proud to be in partnership with various organizations doing the work. I think sometimes we forget that there are such nuances to what funding can be used for. And so for COVID-19, it was direct clinical COVID-19 services, indirect such as outreach, education, surveillance, and increasing or maintaining resources needed to expand the workforce. In addition, we uplifted 20 organizations outside of our bubble. And this was huge because when ARPA was signed in March, we actually didn't get notification till August. Once we got notification, we were able to implement, but we didn't execute contracts because funds weren't received until October. So you're talking 5 to 6 months. And so for us, that the concern that it raised was it was erosion of community trust in Papa and the work that we were doing, but we didn't waver because we knew that this was something that our community needed. And so POL's largest portion of the ARPA dollars of what we got, 3.5 million were distributed, like I said, to 15 partners, 20 organizations total. And it wasn't just about giving money. It's about creating a collaboration, a cohort of sorts that we can help them build capacity, which we also heard from the first panel was very important. In addition, the Namankabai partners work in COVID-19 relief. They overlap in pre-existing needs in our Hawaiian community, and they include sustaining comprehensive primary health care, increasing mental behavioral health services, a rural health youth program, food insecurity and access programs, as well as maternal and child services. This pandemic has driven so much attention to virtual health, but those delivery systems are not accessible for Native Hawaiians that live in rural areas. So these fundings, ARPA through POL includes a local partnership for a broadband infrastructure mapping project. So again, health isn't just the chronic conditions. We're showing that health expands beyond that. And we recognize that there's so much more we can do. And again, thank you.
Thank you so much, Dr. Daniels. We'll now hear from Dr. Lee. Please proceed with your testimony.
Aloha mai kakou, Honorable Chairman Schatz, our aloha to Vice Chair Michalski, and distinguished committee members. Mahalo nui for the opportunity to present this joint testimony on behalf of myself and Dr. Joseph Kabeaimoku Kapalopula, Professor and Chair of the Department of Native Hawaiian Health at the Johnny Burns School of Medicine. Dr. Kapalopula sends his regrets as he is away on travel. I am Dr. Winona Ka'alawahi Lee. I am a Native Hawaiian pediatrician and medical educator. I oversee pathway programs at the School of Medicine to help Native Hawaiian and other underrepresented and disadvantaged students achieve their dreams of becoming physicians. This testimony addresses the fiduciary obligation of the United States in fulfilling its trust responsibility to Native Hawaiians, an obligation codified in federal law. This federal trust responsibility is exemplified in the Hawaiian Homes Commission Act of 1920 and the Native Hawaiian Education and Native Hawaiian Healthcare Acts of 1988. Native Hawaiians are once a thriving and healthy people with a sophisticated social and political system and rich cultural traditions. Following Western contact, Native Hawaiians were decimated by novel diseases, forced to abandon their native language, customs, and beliefs. Today, Native Hawaiians face higher rates of chronic diseases, which include diabetes, obesity, and hypertension. Native Hawaiians also have higher prevalence of mental health conditions such as substance abuse, depression, and suicide. Over the past 2 years, the COVID-19 pandemic amplified these health disparities. Access to quality and timely medical care for Native Hawaiians is challenging, and is in part due to the severe physician shortage we face here in Hawaii, as well as the underrepresentation of Native Hawaiians in medicine and science. Native Hawaiians make up only 4.5% of the physician workforce, while comprising 21% of our general population. Native Hawaiians are also severely underrepresented in health sciences and health-related research. Between 1992 and 2018, approximately 2% of all National Institute of Health funding was directed towards Asian American, Native Hawaiian, and Pacific Islander research. In 2020, 25 NIH research grants were awarded to NHPI investigators compared to 28,587 awarded to white investigators. Pursuing a competitive academic or research career is often daunting for Native Hawaiian investigators because of racial ethnic discrimination, biases, isolation, and a lack of networking and mentorship. Despite these sobering statistics, Native Hawaiian professionals and communities continue to persevere. They work hard to care for their ohana and communities, and they contribute substantially to the greater good while sustaining the legacy of our ali'i and ancestors. We present a brief summary of our recommendations based on evidence within the literature and our collective experiences as Native Hawaiian clinicians, researchers, educators, and community advocates. Native Hawaiian and Pacific Islanders should not be combined with Asian Americans or any other racial ethnic group under a single project or program. Because of differences in health status and the diverse social and cultural determinants of health that impact these ethnic groups, Native Hawaiians and Pacific Islanders must have their own line of funding and their own programs to address unique health concerns, our historical context, and our cultural relevance. Native Hawaiian representation and consultation should be required in the design, implementation, and oversight of federally supported programs aimed at improving Native Hawaiian health. Increased federal funding is needed to support community-based programs whose foundation is strengthened by cultural perspectives and practices. A vast majority of Native Hawaiians strongly identify with their heritage, and maintaining these unique cultural values and practices promotes psychological well-being. Some of our successes at the John A. Burns School of Medicine include the Pili Lifestyle Program to address obesity, the Partners in Care Diabetes Self-Management Program, and the Ola Hole Ikahula Restoring Life Through Hula Program. We recommend broad dissemination of these types of programs implemented in real-world settings such as federally qualified community health centers, the Native Hawaiian healthcare system, as well as other community-based organizations. Federal funding should be used to expand and strengthen culturally responsive and strengths-based pathway programs for Native Hawaiian students to enter the health professions. These pathway programs must be implemented starting in high school and continued at the undergraduate and post-baccalaureate levels. The Imi Ho'ola Post-Baccalaureate Program and the Native Hawaiian Center of Excellence, which I oversee, are long-standing programs that can be modified to create educational models at undergraduate and high schools in the state. Recipients of the Native Hawaiian Health Scholarship are also being unfairly taxed on their professional school tuition by the Health Resources Services Administration. We ask that this be looked into, as the additional taxes imposed on tuition can be as high as $10,000 annually with these scholarship recipients, which adds to their economic burden. And our final recommendation is that federal funding to increase access to behavioral health services in rural and primary care settings must be prioritized. Psychologists should also be included in the Incident to Language in Medicare to allow reimbursement for services provided by graduate trainees under the direct supervision of psychologists. This is similar to physicians training medical residents. This will enhance sustainable training opportunities for clinical psychologists. In summary, we ask that increased federal funding be used to support pathway programs for aspiring Native Hawaiian healthcare professionals, targeted funding for research on Native Hawaiian health, and increased support for the implementation of culturally responsive, community-based health promotion programs and behavioral health interventions for Native Hawaiian communities. Mahalo nui for the opportunity to provide testimony, and I'm available to answer questions.
Thank you very much, Dr. Lee. Ms. Farden, please proceed with your testimony.
Thank you, Chairman Schatz and Vice Chair Mikowski here at Spirit, and as well as her staff and members of the committee, and all of us here representing our law community. My name is Elena Farden. I am a Kanoko Uiwi, and I serve as the Executive Director for the Native Hawaiian Education Council. We are a 501c3 created through the Federal Native Hawaiian Education Act. And on behalf of the 67 current Native Hawaiian education programs, or NHP grantees, and our 13-member council, including staff, I appreciate the opportunity to share testimony today regarding the status of the agencies that govern the accounts, funds, and assets that are held in trust by the United States government for Native Hawaiians. Our council stands in our written testimony submitted. I would like to highlight the challenges in federal policy and intent, as well as program implementation, and the barriers of assessment and access to data. We seek the committee's aid to explore solutions for long-term success outcomes for the program. For federal intent and program implementation, we know that passion provides purpose, but data drives decisions. The Education Council operates in both. It is our strong experience, however, that at the heart of this challenge is a misalignment of federal intent of the Native Hawaiian Education Act and its program implementation. In 2021, due to the great work of the Senate Committee of Indian Affairs, $85 million was allotted to the Native Hawaiian education with the intent to bring immediate monetary relief, and resources to programs to address COVID impacts. We know this as the largest infusion of federal relief funds and the largest award funds to program to date. To give you an example, there are 67 current grantees, 44 that were awarded from ARPA. When we look at the patterns that were awarded between 2010 and 2018 over an 8-year span, the current grantees make up almost 2/3 of that. So we're so excited that so many granting programs were awarded and doing great work in our community. These funds came just in time. NHEP, although stated in the use of funds in CARES Act, received zero relief aid from the state. And many of our NHEP grantee programs were down to skeleton crew operations for over a year and a half in the pandemic. But with relief in sight, the administration of those relief funds came in the same form and fashion of a regular grant competition. A minimum of 50-page application completed in mandatory forms, a 35-day turnaround to complete the application, and the same grant priorities in the NIA or the notice inviting applicants as pre-COVID conditions. This resulted in early learning Hawaiian language medium instruction programs having to compete against post-secondary college and career readiness programs for funding. Education as a whole is a living system, and each part of that system is critical. Discretionary funding in this form is almost cannibalistic and causes unstable funding that impacts the continuum of services for essential programs. We also saw a decrease in funding to Native Hawaiian community-based organizations and increased funding to state programs. Whereas Native Hawaiian community-based organizations typically make up 47% of awarded organization types for NHCP. In 2021, our distribution shows NHCP is down 7%, while the state programs increased by almost 12%, from 25 up to 37.1. While both types of grantee organizations provide needed services, we know that state programs have access to multiple federal and state funding streams, while Native Hawaiian community-based organizations in general do not. So our ask as we come to the table, we'll make sure that we're bringing a solutions potluck that we'd like to explore. Our ask to the committee is to advance community-based resource equity. The Education Council is committed to all allies in this effort to explore funding and program access for innovation in Native Hawaiian education. And we seek the committee's assistance and leadership to investigate opportunities of formula funding to be included through a statutory fix or the next re-auth of NHEA for Native Hawaiian community-based programs that have successfully demonstrated long-standing program outcomes and impact in Native Hawaiian education, while funds to remain available to seed new innovative programs through discretionary funding. For assessment and access to data, the Council is charged by the Act to coordinate, assess, report, and make recommendations on Native Hawaiian education. So we function in urgency to meet the mandate without agency to collect such data. For example, our preliminary findings of our impact assessment and learning study for the 2020 NHEP grantees show that a majority of programs target Native Hawaiian high school students at 63%. And they do so to address priority fields and where Native Hawaiians are underemployed at 78%. This is vastly different funding pattern than we've seen in the last NHEP competition in 2017 and 2018. NHEP awardees from that time targeted early childhood education and elementary and middle school student achievement. So understanding why this is happening and its implications can activate formative processes towards support and essential resources for granting program success. Due to limited funding, the Council has yet to engage in an impact assessment and learning study for the 2021 ARPA grantees, the largest funding received and the largest granting cohort to date. We're also restricted in data access. Rather than sharing data, the Department of Education refers the Council to request NHEP grantee data through the Freedom of Information Act that can take 9 to 214 working days or 7 months, and any applicable fees to acquire that data. So we have resorted to petitioning the individual grantees to provide the data to us. It expands our timeline for research and evaluation and assessment, while also burdening the grantees and sharing their data twice. So how do we evolve this trust relationship? Because we know that shared learning means shared success. Our intent has been clear from the beginning that NHC is not here to compete with the Department of Education because we want everyone to win. So our ask in assessment, analysis, shared access, and learning to data, the Education Council's continued work to fulfill our statutory mandate to gather high-quality data and contribute to evidence-based policymaking for Native Hawaiian education is an essential activity. We seek the committee's assistance to include new language under administrative provisions in the next NHA reauth that directs the U.S. Department of Education to provide a copy of all direct grant applications and grantee reporting documents to the Education Council. To also allocate an additional $1 million to be allotted to the Education Council for fiscal year 23 in order to conduct an impact assessment and learning study on the 44 NHP grantee programs awarded from ARPA. We also asked to establish an Office of Indigenous Language and Native Hawaiian Education within the U.S. Department of Education to work with the U.S. Department of Education in meeting its trust responsibility as stated in the Act, to support work in aligning federal reporting requirements for culturally relevant assessments and program evaluation and coordination efforts with the Council. And lastly, we asked to include new language in the next NHA reauthorization to require training for all senior level and program staff of the Department of Education, specifically the Rural Insular Native Achievement Program, to educate them on baseline understanding of the U.S. trust responsibility and legal and political history of Native Hawaiians with the federal government and the history of the Native Hawaiian Education Act, in order to engage more intentional, collaborative, and mutual support for Native Hawaiian education success with the community and with the Council. In closing, we offer Aiake'ole Kahana, life is in the labor. We know that labor produces what is needed. With much aloha and gratitude, our Council appreciates this opportunity to provide testimony. We stand ready to assist the committee in this work and whatever needs for our community.
Thank you so much to our testifiers, and I was struck towards the end of your testimony, Ms. Hardin, that this is why we have the hearing, right? This is why we fly our staff out from Washington, D.C., is to listen. The now retired Senator Barbara Mikulski used to say, "Nothing about me without me." And I just love that. And especially as it relates to the way people in the federal legislature interact with Native communities. Nothing about me without me. So before I get into my questions, I just want to let you know that our staff is taking copious notes, but in the spirit of a solutions potluck, we will receive all of your offerings and try to get back to you. Some of this, just at the technical level, is not the jurisdiction of the Senate Committee on Indian Affairs, just as a, for example, Dr. Lee, the taxable nature of scholarship revenue is something I have to fix on the Finance Committee side, which is a little bit more challenging because I'm the chairman of the Finance Committee. But we will follow up, and we will also let you know, because I think you deserve this, what we can and can't do. There is no sense you booking revenue that is phantom. There is no sense me telling you that I'm going to work on something if I really don't think I can accomplish it. But since you've given us, a pretty big potluck, we think we can eat together. There's a lot for us to do together. So thank you very much. I'll start with Ms. Daniels. How's her situation?
I think, like Ms. Farden's comments, I think we all struggle in finding our place with our federal partners. And so I think that's the generous version of it. I think we come in really recognizing where our strengths and where maybe we're not quite accustomed to their world in which they have to work in. So we recognize that. But I think we continue to push the envelope, to ask questions. I think if we don't, then we're not being fair to our community. But I think HRSA, has its own challenges in terms of when they turn over. when there's a new administration. I think when they don't quite know where to fit us as Native Hawaiian Health, because we're not an FQHC, we're not a rural health center. Although we have one system that is both. So we don't fit into the box very well. And so oftentimes we're not maybe given some of the same, access as say other health systems, other health centers. And so I think we've really learned to understand our role and ask our questions. I think it could be way worse. I think historically we've had a very uncomfortable relationship with HRSA, but I think moving forward, we're recognizing that our foundation, our work benefits our community, and that's what's our motivation. So really working with HRSA to understand how we can be better partners, and then see what we can change, and in terms of administrative language, what we can change, and really figuring out how we can still accomplish our work. So I think we put the onus on us, than putting it on them.
Fair enough, but I would just observe that we can play a role too.
Yeah.
To the extent that these barriers are really internal to the civil service. And, I come from a family of civil servants, so I use the word bureaucrat admiringly. There are a lot of excellent people that work in agencies, so I don't want to just sort of rail on bureaucracy. But when policy is made, especially through statutory law, and it's already authorized, there is not the discretion to treat you like you don't belong just because they haven't figured out how the statute reads. And so to the extent that you have to fit and adapt and be patient and work with them, that's all fine. To the extent that they're either violating or ignoring a statute, I think that's when you should inform us so that we can say, hey, we know this is different, we know they're not an FQHC, as it relates to DOI, we know they're not a tribe, right? There are all these conversations where we have to kind of walk folks through, and I do this, with my Senate colleagues to have to explain Hawaii to them, right? To say, just as for example, the last mile of broadband is underwater, right? And to try to explain that to my colleagues from West Virginia and New Hampshire is a real challenge. And so, but I don't doubt that just because I've explained it to another senator, that in implementation, that you're not still struggling with difficulties that really should have been handled 20 years ago. So I guess my question is, please ask us where we can be useful without being too domineering.
And I think ARPA is a very prime example where, it was signed in March. We didn't get a notice of award. And in fact, we had to apply for our ARPA dollars, even though they were appropriated to come to us, we all had to apply. And so some of those things were very challenging and it delayed helping our community. So those we have taken the stance of sharing with both your personal office and the Senate Indian Affairs Committee as well.
I have two more questions for you, Dr. Daniels. The first is about the way you're using subcontracting. And the second is about telehealth. So in whatever order you want.
Doesn't matter.
Well, how are you using subcontracting? And then what's the future of telehealth? You may know that I've been the primary author of several pieces of legislation to enable telehealth primarily through Medicare reimbursement, but also in my capacity on the Committee for Military Construction and VA. But wherever I can, I try, and with Indian Health Service, wherever I can, I try to make clear, even in the international space, that telehealth absolutely is the future for equity, for high quality care, for reducing costs. Certain things can only be done in person, but that universe of things that can only be done in person continues to shrink. And so I'm wondering how you're thinking about that.
So let me go back to, our partnering and using that. And so luckily through the act, we have the administrative capacity to subcontract. And what we've been able to do is recognize that, I think fortunately, our community or folks believe that we're tied to our systems. And what it is we're the oversight for our systems. Our systems are one subsection of our act. And so POL actually reaches out to community-based organizations and we subcontract with them quite heavily. So if we look at our portfolio of about $2 million, a majority of that goes out through different partnering mechanisms, including our Maka Maka Ola, which is a small sponsorship to what I like to call mom and pop organizations who don't, it's like the auntie who's running her weekend kalo pulling with the kids in the community. They're not going to be able to write a grant. They're not going to be able, but you know what? She needs to have some water and maybe some rakes and some gloves. She's looking for $1,000. So we do those small, we do quite a bit of those maka-maka-olas. And then we also do larger grants where KKV, we partner with FQHCs and we fund their Hapai Hanal program. It's a culturally based program. It's not something one of our systems does, but we can reach deeper into our community and push our dollars out further so that it's an enhancement of the act, but it also supports and it builds a relationship with our systems and community partners. So we've been doing that. I think ARPA is our biggest flagship that we're watching because it wasn't about giving money to 15 organizations. They had to meet criteria. They were already doing the work. Not only that, but we wanted to see, and we have a range. They're across the state, small, large, but we wanted to see what they look like in terms of capacity. So if we had a small organization and they needed help in building infrastructure, learning how to do grants, that we had partners that already knew that they could work together, build a cohort, but also we could insert opportunities for learning for these CBOs. So it wasn't just about us, it was about these other partners that maybe people don't think fit into our wheelhouse. And so we also started evaluating our program because we want to see what did this $20 million really give us in terms of supporting communities, really uplifting CBOs, not just our systems. So our Namakabai dollars, our ARPA dollars are split into our tier 1s, which is our systems, and our tier 2s, which is our CBOs. And we're able to look at the data in terms of what they're collecting, how they're collecting, all of those things, and we're going to do a roll-up report. This is very new for us because we wanted to demonstrate that we have capacity to take in large numbers, large monies from the federal government. So ARPA really helped kind of invigorate what Hawaiian Health could look like. And then we were able to secure monies from HRSA. We were able to partner with national partners such as Morehouse School of Medicine to get OMH dollars. All of those big dollars were coming to us, not via the state. And that's a change in that direction. And we got it because we could demonstrate that it wasn't just this small little group of folks, that Hawaiians are larger than just what our systems see on a day-to-day. So yes.
I'll just observe that when I'm fighting for federal funds, the reason you're on this panel, all three of you, is that the challenge when you're advocating for your home state's priorities is to articulate two things. One is that this fits into national federal policy. That part is easy. The second is to make sure that I can look my colleagues in the eye and say they will execute and they will execute responsibly. And because of your track record and your growing track record at scale, I think we're in a position to make the argument to whether it's Patty Murray as the chair of the Health, Education, Labor, and Pensions Committee, or the chair of the Appropriations Committee, that they know that my word is my bond, but also that the organizations that we're trying to fund do excellent work and they will not be embarrassed. And so thank you for that. Just quickly on telehealth, how do you see the future for telehealth?
So I think it's expanding. I do think though we saw systems not take full advantage early on in the pandemic, but I think people are playing catch up. I think some of the areas that we're still trying to navigate is when we look at prescriptions, being able to use docs that are not in state, because right, we could use locums. So if they're not able to prescribe in state, what does that look like? So those are that is one glaring piece, is that prescribing space. Also, I think having folks recognize the growth of what telehealth could be and having the foresight to plan ahead in terms of equipment. And, so we're not saying, oh, a couple of years gone by, the equipment's not useful anymore, but really being thoughtful of how they do that. And that's part of one of our partners is we funded a broadband mapping project so we could understand, I think, more clearly how broadband affects Ka'u over in, South Point of Hawaii Island, how it affects, up in Princeville or Waipa'a up in Hawaii. These highly rural areas, how do we help create success for them? So yes, I think it has potential. We just gotta recognize some of those little bumps and address them ahead of time.
A couple of closing thoughts on telehealth before I move on to Dr. Lee. First of all, we have Dr. Amy Grace here in the room, working at the University of Hawaii, who helped me to author several pieces of federal legislation around telehealth. So we got some really good expertise locally. A lot of our original bills came from organizations based on Oahu. So there's room to kind of just learn from each other. And then just one final observation is that I worried a bit that although there's a need for high-speed internet connectivity for some telehealth, there's not a need for high-speed connectivity for all telehealth. A lot of the technology is pretty low tech. I mean, even telephonic communication, store and forward technology. My favorite example is that because I grew up here and because I'm Haole and I'm always checking for moles on my shoulders to see whether everything is cool or not. And I've learned now that Kaiser will let me just take a picture, send it to my BCP, they email it to Durham, and then everybody saved a ton of money and time. And those are the kinds of things that I think can precede the deployment of broadband. Broadband is great, and we should be working on this for health, but also economic and cultural equity reasons. But in the meantime, there's a bunch of telehealth we could be deploying as we go along. Dr. Lee, I want to just kind of linger on the disaggregation of the data thing, because I struggle with it too. AAPI is not a phrase that I even remember having heard before I got appointed to the United States Senate 10 years ago, because we don't lump everybody together. Now I understand the kind of political impetus because there's strength in numbers. And so if you can form a coalition of Asian American Pacific Islanders, that's more people and therefore more political clout. But in the context of the delivery of service, it kind of makes no sense. And I'm wondering if you could just articulate exactly why you think it's so important to disaggregate data. I remember my staff coming to me and saying, we need to disaggregate AAPI data. And I confess it took me maybe 18 months to figure out why it mattered, but now I get it. And I'd like you just to articulate it for the record.
Thank you for the question. No, I do think there are strengths in numbers, and collaborations are so important. So to have consortiums and collaborations with Asian American, the other Pacific Islanders is crucial. But when looking at data, it is so important to disaggregate the data. In my professional work, I work on pathways. So I work on helping medical students and pre-med students get into medical school. Right now, the American Association of Medical Colleges, they have not been disaggregating our Native Hawaiian student data. So we are clumped together with Pacific Islanders, at times with Native Americans. And so you don't get a clear picture, a clear, accurate representation of where we really are. So we're trying to work towards increasing the number of Native Hawaiian students. We have no idea of where we are on our map. We don't have a guide. And so it's really important that the data matters. And I know that our panelists have talked about having capacity to have data. So I think part of our goal and our resources is to get disaggregated data, to demand it. And so the AAMC has allowed us to get disaggregated data on our students, and that's the first step. When it comes to Native Hawaiian health statistics, it is also very similar. If we don't understand how our people are being affected by diseases like hypertension and cardiovascular health, we don't have a clear picture of what is really plaguing the health of our people. So it's really important in our community-based health promotion programs, such as our HULA study, we were able to do comparisons of Native Hawaiians with other ethnicities. And therefore you have a better picture of the impact of these cultural interventions along with modern medicine. So it's really a bridging, I think, of the strengths of people. We've had a very difficult history but we have survived and now we're in the time of thriving. And so I think data is powerful and data is very important.
One more data question. You said 4.5% or so of medical students are Native Hawaiian, is that?
Of the physician workforce in
Of physician-
Hawaii are Native
physician
Hawaiian.
workforce in Hawaii, okay.
Yes.
Do you have similar data for nurses and nurse practitioners, or do we not know that?
Yeah. I believe there is data on nurses as well as allied health professionals, so I can provide that information to you. We don't house that at JobZone, but we do have partners who have that information.
Okay, I assume they're correlated maybe slightly better on the nurse side.
Yes, there is some great work being done at the University of Hawaii School of Nursing, and so they've seen a boost in their Native Hawaiian programs in the amount of nurses. We have seen, it's a small move in the needle, but previously we had a 3% prevalence of Native Hawaiians, and now we're up to 4.5%. So it's slow moving, but we are seeing definite changes.
And I assume it's everything, right? It's educational attainment, it's money, it's pathways, it's mentorship.
Yes.
But if I had to guess, it's money.
That's the biggest one. So in our testimony, we really outline what keeps Native Hawaiian students from achieving higher education. And it's really, 15% of our Native Hawaiian students under the age of 18 are in extreme poverty. And when you're in the situation where you're just trying to make ends meet, your parents are working multiple jobs, the thought of college is so far beyond. And so for us, our goal is to get out to the communities, equip families with information, and to work on building financial plans for this family to ensure that their student can go on to college.
Yeah, thank you very much. Ms. Pardon. So the Department of Education has, in my view, failed to recognize the special legal relationship between the Native Hawaiian community and the United States. Can you just, without getting yourself in trouble, articulate some of the difficulties that you've experienced with NHEC as a result of this failure of understanding?
I think the relationship just needs to evolve a bit. The way that we interact with the Department of Education, we want to be best friends. I'm just not sure where we land. We are also treated in a way that even though there's a certain amount of funds that are allotted to the Native Hawaiian Education Council, each appropriations to do the statutory mandates of technical assistance, coordinating activities, and other research, the U.S. Department of Education views the council as a grantee rather than a co-partner or a co-researcher. We feel that—
I'm sorry to interrupt, but what does the law say on that question? I mean, do they get to view you as a grantee if you're not, or are you a grantee at the technical level?
I might say that we are, since we do get funds that way, but it doesn't say whether we are a grantee or not. The origins of the Native Hawaiian Education Council came about in the 94 re-op for the Native Hawaiian Education Act, and it was a movement from the grantees themselves. Over 200 grantees put together in Washington, D.C., many of them working in the education spectrum, but not knowing who is working in that same sort of arena. As you had mentioned in the first panel, sometimes it's just a coordination that needs to happen. And so the grantees asked for some sort of coordinating entity, an intermediary entity that can help usher research and support for the grantees themselves, basically being a mouthpiece and advocate for them, but also support for the Department of Education. So we see the department in being very well situated to monitor short-term and medium-term outcomes for the program based on the grant cycle. But we see the council better positioned in long-term outcomes. What happens after the grant's done? What are the impacts in the community? So we see our services and our work very complementary, and we're also very much a part of the community. So we have skin in the game, and we're ready to play. We're hoping that the Department of Education would also be open to playing this too.
Thank you very much. You're all more diplomatic than I am. Let's do this just as a follow-on item for all three of you. We have a tendency to, and it's a reasonable way to operate, to only ask for my intervention if things get in extremis, right? If to get quite bad for me to get on the phone or write as we say in Washington, a sternly worded letter. But I think there may be some value in kind of trying to get in front of some of these questions because the Biden administration, I think, at least has a mindset of being more open. Now, the execution on that often, can't just be that the Oval Office is committed because you have individuals burrowed into various agencies that you work with every day. And they may not be super thrilled to have, a senator intervening on small things. So you make your judgments about when you want me to be engaged, but I would just offer that I'm willing to be engaged on the front end, and maybe we can avoid some of these difficulties and clear some of the underbrush. I just, I ran a nonprofit and I remember like small favors, right? It's not always the big things that you need. You have these big grants. Sometimes you need to unstick something, or even just have someone remind an agency head or a line analyst that, oh no, the statute permits this, and this is what the help chair wants, and all the rest of it. So allow us to try to get in front of it to the extent that it's appropriate. And I also understand that you need to maintain your working relationships line to line. And not feel like every time you don't get what you want, you're gonna come running to me, because that'll create new difficulties for you. So, but let's try to figure out how we can get a little bit in front of this. So the most recent elementary and secondary education reauth changed the composition of the Native Hawaiian Education Council. How's that working? Is it going well? Tell me about that.
It's progressing well. There's always room for improvement. I think since the last reauth in 2015, it took maybe 3 to 4 years to get everyone on board. So of the 15-member council, we have 11 seats filled, which is 4 vacant seats. I think what might help in working it forward better is understanding how we recruit our council members with the passions that they already have. So research, evaluation, language, and cultural education are really strong points in the research that the council does. It may not be the passion that everyone that's named on the council has to do. In addition to that, as
I don't understand what that means.
Sure. So pathological theory, you're playing on someone's passions and power ability and what they naturally do already. Oftentimes there is a long onboarding process for our council to get up to speed on what the work is, why it's important, how it impacts, and then to get their hands dirty on the actual work that we do in the community. Not all of them come to us with their research background or Native Hawaiian education background or policy background, but as long as we have someone that's willing to work with us. In addition to that, I might want to also share that with the appointees to the council, as each election cycle comes in and out, it is a new opportunity for us to have to reach back to these organizations that are state institutions to name an appointee to the council. So it's a continual cycle of onboarding, offboarding.
I'm embarrassed. This is probably a terrible way to end the hearing to say I don't know something, but I'm embarrassed to say I don't know how the council members get appointed. Are they gubernatorial appointments? How does this work?
Sure. The council is named within the law, so it will identify a state and educational institutions that are named in the law. So system, the governor of Hawaii, OHA chair, the KS CEO, for example, these are all named, as well as all of the county mayor offices are named within the act itself.
I see. So then each OHA or the Maui County mayor, there's a new mayor, there's a new member. And so part of the process is to make sure you don't get someone who's just close to the mayor and knows nothing about this, or whatever it may be. Nothing wrong with being close to a mayor, but we want them to provide oversight and stability and guidance for Brandon. Okay. Well, listen, I really want to thank you for the work you do. A bunch of hearings this year. This is my favorite. It's not just because I'm home, although that's a lot of it. But you do extraordinary work, and you make us all incredibly proud. So I want to thank all of you. I want to thank everybody for being here. I want to thank my staff. The hearing record will remain open for a couple of weeks, and we may submit additional questions for the record, and members of the Committee on Indian Affairs may do so as well. Thank you very much. This hearing is adjourned.